By Deirdre McPhillips, vaccination rates for measles and other diseases dropped again last school year, according to a study published on Thursday by the U.S. Centers for Disease Control and Prevention. Coverage against measles dropped to the lowest it's been in more than a decade. School requirements do not include the COVID-19 vaccine, which is explicitly banned from being included in school mandates in at least 20 states. However, the COVID-19 vaccine will become part of the CDC's recommended immunization schedule for both children and adults this year. About 93% of kindergartners enrolled in the 2021-22 school year had received the required vaccines, including measles, mumps and rubella, MMR, diphtheria, tetanus and acellular pertussis, DTaP, and polio. Coverage fell for the second year in a row amid the COVID-19 pandemic, down from about 94% the previous year and below the federal target of 95%. As schools return to in-person learning, high vaccination coverage is critical to continue protecting children and communities from vaccine-preventable D. Clusters of unvaccinated children can lead to outbreaks, they said, and a vaccination rate of about 93.5% leaves about 250,000 kindergartners who may not be protected against measles. Ohio is one of 9 states where fewer than 90% of kindergartners were vaccinated against measles last school year. An outbreak in the Columbus area starting in November has resulted in 83 cases among children, the vast majority of whom were unvaccinated. While in-person learning has returned to schools across the country, COVID-19 continues to disrupt vaccination assessment and coverage, according to the report. About half of states cited reduced access to vaccination appointments, extended timelines for enforcement and delays in data collection. A recent survey from the Kaiser Family Foundation separately found that more than a third of parents oppose vaccine requirements in schools, even if the option for individual choice could create health risks.